Hi, everyone, and thank you so much for joining us as we celebrate and learn from our 2025 Public Health Reporting Fellows. I'm Beth Francesco, Executive Director of the National Press Club Journalism Institute, and I'm thrilled to introduce you to our first fellowship cohort. For the last 6 months, these 5 journalists have investigated vitally important public health issues for communities across the U.S., including access to maternal health and cancer care in rural locations, the loneliness epidemic among the elderly, the spread of H1N1 among immigrant workers, and the impact of current immigration policies on public health. We'll learn more about their projects and their outcomes from our fellows shortly. You might be asking why this focus on public health journalism and why now? To help set the stage for our conversation, we are joined by Dr. Dave Choksi. Dr. Choksi is a practicing physician and public health leader and currently serves as the Sternberg Family Professor of Leadership at the City College of New York. He is co-chair of the Health and Political Economy Project and previously served as the 43rd Health Commissioner of New York City. Dr. Choksi is also chair of the Common Health Coalition, a large network of leading health organizations whose mission is to unite the nation's healthcare delivery and public health systems hand in hand. We're incredibly grateful to the Common Health Coalition, which provided generous financial support to help launch this fellowship program. Dr. Choksi, the floor is yours.
Well, thank you so much, Beth, and to all of you for being part of this first of its kind fellowship. I'm really proud that the Common Health Coalition has worked with NPCJI to launch the fellowship with really one central question in mind, which was, how do we pull back the curtain on our health systems? For so many people, of course, the pandemic offered the first intricate glimpse into the machinery of public health, contact tracers, vaccine clinics, community health workers. But we know that when it comes to demystifying the health system, so much remains elusive. And well, to the NPCJI journalists, you don't need me to tell you this, of course, but your work is helping to make those invisible components visible. You're showing how the systems that shape people's lives actually function. And in doing so, you're giving the public tools to decide whom to trust and what actions to take for their health and for the health of all of our communities. As Beth articulated, I really feel deep conviction that this work has never been more important. Public health reporting is increasingly politically charged. It carries real risk. And now it faces new headwinds with the recent cuts to public broadcasting as well. It's very concerning to me as someone who cares deeply about health to imagine a world with fewer platforms and fewer trained journalists committed to translating complex health information with neutrality and while remaining nonpartisan. That's why I'm especially grateful that through this fellowship, the coalition has a chance to double down on those values. I also wanted to take a moment to just shine a light on another critical role that you play. You're not just a vital resource to the public. It's a two-way street because you also transmit essential stories from the ground back to health leaders and decision makers. Let me just give you a small example from our recent experience. Our managing director for the coalition, Chelsea Cipriano, recently participated in a conversation hosted by the podcast, Why Should I Trust You? Between representatives from Make America Healthy Again, or MAHA, and health experts. When I was listening to the conversation, for me, it was a powerful reminder that to channel the writer Chimamanda Ngozi Adichie, there is no single story of lost trust in health institutions. People arrive at that place for very different reasons, and they navigate to alternative sources of health information with real intention. So from the health perspective, if we want any chance of earning that trust back, and really of being worthy of the trust in the first place, we have to listen to those stories in all of their complexity. So for these reasons, your storytelling matters deeply. It's been a privilege to follow your stories over the last several months, And I've been so impressed by the way each of you approaches your craft with nuance, clarity, and care. I'm truly excited to hear a little bit more about your work today. And on behalf of the coalition, I really want you to know, and I hope you take away, that we're always at your disposal. I hope you think of us as a unique organization with reach across the entire spectrum of health systems, clinicians, payers, public health officials. So whether you're unpacking a meaty health policy or tracking down the right expert, we're here to support you. So thank you again for the privilege of being a part of your inaugural fellowship. And with that, I think I'm going to pass the baton back to you, Beth. Thank you.
Thank you so much, Dr. Choksi, and to the Common Health Coalition for its important work and support of this fellowship program. Now let's turn over to our fellows who have been working the last 6 months on their projects. We're going to take the next 20 minutes or so to learn more about what they've been working on before we dive into the news gathering process and what they've learned about covering public health in this time. I'd like to invite to the screen Amanda Seitz, a healthcare policy reporter for the Associated Press. Hi, Amanda.
Hi, thank you so much, Beth, and thank you to the National Press Club Journalism Institute for hosting this and supporting this work, and thanks to everyone who is joining today that has interest in it. So I'm a healthcare policy reporter for the Associated Press in Washington, D.C., and I cover the Federal Health Department.
Great, Amanda. Do you want to tell us just a top line what you worked on and kind of a little bit about what you uncovered along the way?
Yeah, well, we set out to do this project because we knew from listening to President Donald Trump on the campaign trail that tougher immigration policies were going to be the #1 focus of his administration. And so we wanted to take a look at how those tougher policies would impact the care that people receive, particularly immigrants who might not be living here legally or their family members as well who might be living here legally. We knew from looking at previous research that was done that there was some steep declines in how immigrants were accessing healthcare during the first Trump administration. And that wasn't a story that was particularly strongly reported out because some of this research was published toward the end of his administration or even after it had concluded his first administration. So, and we were also tracking some Republican-led states that were implementing newer immigration policies in the emergency room directly. So we narrowed in on telling this story. We wanted to look at where's the best places to tell the story. We narrowed in on the Rio Grande Valley in Texas because we started looking at, okay, where is the highest uninsured rate in the country? And that region boasts one of the biggest populations of uninsured folks in the nation. About 30% do not have health insurance compared to the national average of 9 to 10%. So it's a really huge gap there. And we started reaching out to some folks in the region. One of the biggest challenges that we came across early on was the threat that the Trump administration made very, very quickly in the first couple weeks of taking office to public health funding, university funding. So we had a really big challenge in getting people to talk with us on the record who are either working in this space or have researched this space because frankly, they didn't want to draw attention to the fact that they serve communities that might include immigrants who do not have legal status here. That was a huge challenge throughout telling this story is people did not want to put their staff, their patients, and their clinic funding at risk to talk to us, especially those connected with larger health systems and universities too. So I kept kind of working the phone every week with sources, and we were led to this midwifery in Westlake, Texas, that invited us in and really let us spend some time there, getting a look at what they do and the patients that they serve. Again, this is in southern Texas, and we really spent some time sitting down with folks in that community and learning just how scared they are to not only seek out healthcare, but just leave their homes. because of the new policies that have been put in place around immigration, that region of Texas has been hit very hard. You have people that have been escorted out of their restaurant shifts in some cases. They've raided, the local flea markets there. So we were really able to, because people were so eager to talk to us about what they have been going through, we were really able to tell the story of how people are staying inside of their homes, not leaving, even when they need to fill a prescription, even when they need to go to a doctor or visit the ER.
I think that one of the things you talked about, just the fear factor and how sourcing on some of these really important stories has become more challenging, something that has come up for some of your fellows during this process. So I'm going to now invite Ligia Navarro, who is an award-winning bilingual and disabled independent journalist, to join us on screen. Amanda, you're welcome to stay while we meet Ligia. Hi, Ligia.
Hi, thanks so much, Beth. And thank you to everybody at the National Press Club Journalism Institute and the Common Health Coalition. The support for this fellowship has just been amazing. So I'm Ligia Navarro. I'm a career-long independent journalist. And for this story, which has extended into a series, I'm working with The Sick Times, which is a nonprofit news outlet dedicated to covering public health issues related to long COVID, the ongoing COVID pandemic, and future pandemic threats. So the way that I came to this story was in 2024, I started paying more attention to stories about bird flu. And this was once human cases had begun and then really started to ramp up in the US last year. Avian influenza, or H5N1, as it's often called, has historically been quite severe in humans, killing more than 50% of those who are infected. And so as I was paying attention to the news about it, I began to notice who wasn't being talked about and who was also most at risk of H5N1, which are farm workers, many of whom are Latina immigrants. And so for the past few months, I've been looking at the impact of H5N1 on Latina immigrant farm workers and how their intrinsic vulnerability has played into the unfolding bird flu phenomenon, on which the federal government has been very slow to act. I've focused on Latina stories my whole career, and so what I found wasn't really surprising to me, but it was definitely disturbing. State and federal health officials and agencies stress that the general public is at very low risk of H5N1. And this is everywhere, in the news, in public information pages, and usually quite vaguely mention that farm workers are at high risk. So you've got very low risk for the general population and then high risk. But for the large part have neglected to enact change to protect farm workers. Many farm workers, especially on dairy farms where workers are at even higher risk because of how H5N1 spreads through milk, have received zero education on H5N1. And so when farm worker organizations or community health workers show up to provide the regular support that they provide to these communities, farm workers will tell them of having had pink eye, which they think, they thought was nothing, but it actually turns out to have been H5N1. And even before the escalation of ICE detentions over the past several months, Latina farm workers were very afraid to try to access healthcare because they're so often uninsured and because they have no sick time. So they risk losing their jobs if they miss work to go to the doctor. An interesting aspect to this story that is, in some ways, it's quite explosive. As much as farm workers are really treated as an aside on H5N1, they are at the front lines of what could well become a human-to-human transmission pandemic. So it was only last year, and again in 2024, that H5N1 was found in cows in the US, which was a major evolution of the virus to go from birds to mammals, although there had been some other mammals infected in the interim. And so the more people who are infected with H5N1, the more likely it is that the virus will mutate to allow humans to infect each other. And infectious disease experts I've spoken with, who saw how unprepared the world was to deal with COVID at the beginning of the pandemic, warned that this could get very bad. So it's urgent that more is done to quickly protect farm workers, because that in turn will protect all of us.
Such an important story to tell, and I really appreciate that you started your approach to this story with thinking about who isn't being talked about when it comes to this topic. So we're going to dive into that in just a little bit more. Thank you so much, Leisha.
Thank you.
I'd like to invite Ted Alcorn to the screen now. Ted is an independent journalist who reports on health and justice. He also teaches at Columbia University. Ted.
Hi, thanks for having me. So just to briefly recap the reporting I did, actually, it's a little bit of a convoluted origin story, and it reveals something about the life of a freelancer and the difficult days of journalism. A major newspaper asked me to look into some stories on cancer, and I spent a lot of time kind of familiarizing myself with what I thought is a really important and neglected topic, which is we've had these huge advances in immunotherapy, and in all sorts of cancer therapies that have really changed a group of diseases that had a lot of stigma surrounding them because of their lethality into oftentimes treatable conditions. But those advances have really not been as accessible to rural Americans as they have been to urban Americans for a whole host of reasons. And so I thought this growing gap and disparity was really important, particularly since rural and urban dynamics in this country overlap with politics. And of course, then the newspaper dropped its interest after I'd done all this work. I went to Stat News, who were interested in the story but had no funding for it. And then this opportunity arrived, which really made some reporting on this possible. So long story short is there's all sorts of different rural areas in the United States, and you've seen one rural area, you've seen one rural area. They're very different in terms of the way that these disparities, I think, are expressed. But I opted to look at Kentucky, partly because it has the highest rate of cancer in the country, or among the highest incidence and among the highest mortality rates. And it's used to being kind of the getting kicked around a little bit for being at the bottom of the pack, but there was a really interesting thing happening there, which was a university hospital system had been working with rural hospitals in a way that it was getting a lot of praise from other corners of the country for eliminating those disparities. And I thought, let's go to Kentucky to look at sort of success story in improving the quality of rural cancer care. Of course, I didn't at that time think ahead or know enough about Kentucky to realize it would also be the place that Medicaid expansion has had some of the biggest impact on rural areas, and where Medicaid cuts now may be most disastrous. And so it ended up being an opportunity really to be in rural areas there, seeing and learning about how to improve quality of care for people who are suffering from these very common, very serious conditions, but also to sort of get a preview and talking with people about what's going to happen if the rug gets pulled out of under them when Medicaid cuts really materialize. And the rural areas in Kentucky are estimated to see a bigger loss in monetary terms than any other state's rural areas in the country. So that's a preview.
Thank you, Ted. I'm going to now ask Jamal Jordan to join us on screen. Jamal's a multimedia documentarian who's currently working as an audience editor at the Washington Post. Jamal, welcome. It's good to see you.
Hey guys, happy Friday.
Happy Friday.
So I'm super excited to be here. Thank you all for all the support you've given me, and I feel so honored to be amongst the other fellows. Everyone is so smart, and everyone's stories are so brilliant. I decided to take a somewhat different approach to how I am looking at public health reporting. I'm generally fascinated with how health interacts with the other parts of our life, the way that we entertain ourselves, the way that we find love, all those kinds of things. For this series of stories, I was inspired by some previous reporting I was doing on LGBTQ elders. I had written this story a couple years ago about a couple that was in their 80s in Detroit. And they made an offhand comment about how much work they did to help alleviate loneliness amongst other people in their community. Years go by, and we have our public health declaration of like loneliness as an epidemic. And I just like immediately want to know like what other communities of elders are doing things to help alleviate this sense of loneliness. So I am with the tumult in my job, the timeline of this is expanded, but I am in the process of continuing to explore different senior citizen communities around the country and like find examples of communities that have been built. I've like using one statistic that is kind of like the guiding force, like pushing me forward. I read that most people in my age cohort have a profound fear of the uncertainty of age, largely based around just like the lack of actual stories of people in older age like prospering. I started off going to meet the senior citizens of Retirement House, the famous TikTok account, at their hype house in Los Angeles. I was going to play a video of them dancing around with me, but I don't want to waste too much time. My last story, I went with the techno grandma to a music festival and spent 10 hours with her dancing and listening to house music. And it was such a fascinating thing to see, just like the way that her group of friends of like 70 to 80-year-olds have been able to bond over this like very particular thing. I'm finding that so much of the fear that I personally had of growing old is really like not in my head. It's a very like serious public health issue, but I'm really inspired by the different ways that I was seeing people build community across the country. And I'm super excited for you guys to see it too. The photography is going to be really great as well.
Thank you, Jamal.
Yeah.
And now I'd like to invite Eleanor Klibanoff, the Texas Tribune's women's health reporter based in Austin, to the screen. Eleanor. There you are.
Hello.
Hi, Eleanor. Tell us a little bit about your project.
Sure. So as you mentioned, I'm the women's health reporter at the Texas Tribune, cover like a wide range of health issues, and one that I've long been interested in and have done some coverage of, but not as much as I'd wanted to, is access to maternal health care in rural Texas, which is like a big issue that people talk about a lot and not a ton gets done on, and like not a ton of coverage, in part because Texas is giant, and getting out to these rural areas can be pretty difficult. And and also I think in large part because like rural communities, you know, like many communities that are sort of written about by people who aren't from there or don't know much about them, are pretty wary of the media. And I have found, it's hard to sort of build that trust with those communities over the phone or just like dropping in to do a quick story when things have like gone awry in that community, which tends to be like when we show up. So that was like my real interest in this fellowship, was to get some of that additional funding to fund like more robust reporting trips and spending more time than the Tribune maybe typically would be able to support in a community building that trust. So I'm ended up highlighting doing a story that is not out yet, but coming soon, about a community in super North Texas, like basically Oklahoma, that their hospital, they're actually building a new hospital, which is very exciting. But they are unable to support a labor and delivery unit in this new hospital, and it's like torn the whole town apart, and everyone's very mad at each other. And it made for a really interesting way to sort of talk about all the challenges that rural communities are facing. In like, everyone wants to be able to deliver babies. The state and federal policies make it really, really hard to support that. So this town is kind of a microcosm of all of those challenges. And honestly, going out there and like spent a lot of time out there and got to really know a lot of the people in town, and that made a huge impact on being able to tell this sort of like 360 story of what's going on there.
Thank you, Eleanor, and to all of our fellows. It's so nice to see you all on screen together again. I think, Eleanor, you just gave us a great segue into my first question, and feel free to hop in however you'd like here. But each of you has referenced sourcing in some way, and how you gained the trust and connected with either individuals or families or workers. Wondering if you could talk a little bit more, especially about covering communities who are already vulnerable, but may feel even more targeted in this current environment. We've hinted at that a bit. And then Eleanor, I think you just touched on the parachute, effect that can sometimes happen when it's difficult to reach rural. So let's just generally talk about sourcing and that kind of building trust with folks. Who would like to jump in?
I don't think I think there's other panelists here who really went further and built relationships that were more fragile and admirable than what I did. But I will say, my focus was on rural people who were affected by cancer and in a state that I didn't have a considerable amount of background in. My family's originally from Kentucky generations ago, so it was really amazing to go back near where they homesteaded, but it was really my first time being there. So sometimes in my reporting, I'm pretty skeptical of power generally. I write a lot about big institutions and I kind of see the commonalities and how they work. And so I'm usually kind of kick against trying to trust them to help put me in touch with people because I generally think they do things that support their own point of view and perspective. But in the healthcare setting, it can be really hard to get in touch with patients because especially patients who are recovering from illnesses, just identifying them or speaking in terms, outside in a context where they can share personal details, medical details. And I'm almost always found I have to rely on clinicians working through them. And in this case, because this hospital had really been admired by other outside researchers, and I've written about the antitrust issues around hospitals, and I'm pretty skeptical of their nonprofit status and everything. But in this case, I said, I'm going to go with the flow. I kind of embraced this hospital. And I said, I think what you're doing is good. Can you help me? And then, I entrusted myself and they really did a lot of work. Their communications team and the doctors and administrators involved. Of course, they wanted to tell a positive story about their work. But I kind of allowed myself to be handled a little bit more there than I normally would. And invariably, of course, people say things off the cuff and, not in a controlled way that I think you still get a very authentic experience. And I was introduced to patients who, were positive success stories. And were cherry picked a little bit by the hospital, but also, especially since I'm sort of dropping in, I think being aware of that, talking about it with my editor, and then, invariably sort of see around sometimes the way that the entity that's helping you is trying to treat. So anyway, long story short is, I relied on this sort of like institution that did have a reputation there that was a part of my story and just tried to keep a 360-degree view.
Yeah, I'd like to follow up with what Ted is saying, that in order to do the story focused, I was parachuting in, so I was one of those people that does that and always tried to keep that in mind in the back of my head. But I knew from the beginning that I was going to have to also find an organization that would either give us some sort of access or let us shadow them was, always what I had hoped to do. It became very clear very quickly that I was going to have to find an organization that was not worried about its federal funding, because we were getting shot down left and right from groups that were just so worried that if they brought any attention to the fact that they treat people who, might not have permanent legal status, that they would quickly become a target. So that was very key. And we were really lucky that we built trust with the director at a clinic at a midwifery in South Texas, who I just have to say it was so impressive with how she approached this as well, and talking to her staff and kind of briefing them on what to expect. And making sure everyone was on board. But because she did that, we were able to really take free reign for a couple of days of their clinic and follow folks everywhere. And I would just add one other thing, especially as someone who works in Washington and is covering, lawmakers and the secretary and these people every day. What really shocked me was just how desperate people in this community were to have their story told. My co-reporter and photographer Jacqueline Martin, who worked with me on this story, we went in like hoping, okay, maybe we can just get one person that will talk to us, like one person who is worried about their legal status, that has this, has something to say about how it's impacted their medical care. And we ended up talking to dozens of people over just a few short days because people so desperately wanted to have this issue highlighted in some way, and they do not think that people care. They just wanted to be humanized in some way. So that was something that was almost kind of surprising to me, that just how desperately people wanted their story told. And I think it's an important reminder as someone who covers policy that we should put the people who are going to be impacted the most by policy at the front of these stories.
One thing I'll just add on that is I think very similar, like once you sort of get past that initial resistance, I think people really do want to share their story. They're just like understandably very worried that you're going to share it wrong or bad. And I think that's fair. Like, I think people have very little contact with journalists day to day and like don't know a journalist and don't know what we're doing. And I had a really eye-opening experience on this, in that in town that I was writing about, I did so much work like building trust and all of that stuff. And then the last day that I was there, I followed this doctor who's been delivering babies in this town to the new town where she's delivering babies like 40 minutes away. And with that, in my mind, I was like, well, we're not writing about that hospital. Like, that hospital's not the focus of this. And so I talked to the CEO sort of briefly and said, like, can we come by? We're just going to photograph her at work. Like, I'd love to chat with you. But like, I was not making the same sort of like deep effort I'd made, because in my mind, I told her, you're not the subject of the story. Don't worry about it. This is really about them. Like, your hospital might not even get mentioned. It's just sort of where, and it did not go well. She was like very freaked out by a reporter and a photographer rolling in, and got very defensive and very upset with the doctor. And it was, it all ended up being fine. Like, as soon as we like dropped our, we were like, absolutely, like, you're right. We came in hot. We should have like done this, like, let's chat. It was all fine. But it's such a good reminder of like why we do that prep work, and why like just saying to someone like, don't worry about it. Like, people I think assume at all times that they're about to be the subject of some big expose, and like just telling them, no, you're not, or like that, is not enough. And so I think it was such a good reminder of like why we do the work of building this trust, and how like you need to do that, triple, because the worst case scenario is that you don't sort of repair that, and then you've left this person who's going to tell everyone she knows, like, oh, the media is terrible, a journalist is terrible, they, here's my awful experience with them. And like, that sort of hurts all of us when that happens.
I'll just jump in quickly. For this story, I found myself having to go through intermediaries to find sources, which is not something that I usually like to do. I usually find a human to focus my story on, and then talk to, experts or officials kind of like tangentially around that. But because the population that I'm reporting on is so vulnerable and so isolated and so, um, yeah, it's not like, I tried like to try to find people on social media, but it's just not possible. So I found myself having to go through nonprofits, which is great, except for the nonprofits right now are really afraid and they're really overworked. So it was even harder than normal to get responses, to get interviews, to get connections. So yeah, I mean, I mentioned this to Beth, uh, kind of in like debriefing, that this was one of the hardest stories that I've worked on, and I've done investigative work before, but this just like the level of fear at that everybody is dealing with, fear of, getting defunded, of getting attacked. It's just so pervasive, and it's so, I feel like it's debilitating to a lot of people, in a way that I wasn't necessarily expecting. And, as like Ted said, I am also often very skeptical of power. And so that's part of why I've focused my whole reporting practice on reporting a different way. But it made me a bit more, even more empathetic towards people who I normally would have seen as like in positions of power. Like, I spent a lot of time explaining to people at nonprofits and medical experts about what on background means, what off the record means, and allowing people to go back and forth between different levels of transparency throughout their interviews, which is something that I might not normally have done. But I felt like in a lot of ways, everybody I was speaking to was vulnerable in some way, because everybody essentially, if they said the wrong thing, was at risk of losing their job.
I think that's a really, really important obstacle that I'm seeing a lot. I'm seeing heads nod, and we've alluded to it. And even Dr. Choksi referenced this earlier. I mean, this reporting that you're doing on these vital topics is coming at a time of upheaval in the public health sector. So obviously the numerous policy directives, mass firing of federal personnel, and of course there's the trickle down from that, and then the disappearing of data. So, you've each referenced some of the challenges and how you worked around them, but I'm wondering if there's anything you'd like to surface for our audience that you ran into in reporting on your pieces.
I think, I mean, and this is, I'm certain true for all of us to some extent, like just the way things are changing so fast. Like, I think I was out in this town talking to them, and like, but it was before the big, beautiful bill passed and threatened rural hospitals. And then you have to call everybody back and say, like, are you freaked out about that too? And like, then you sort of like, it's just, things are changing really, really fast in a way that I think makes things, it really, difficult to like grab onto one narrative, which I think actually, like in my case, like spoke very well to like what these rural hospitals face, which is like they're like one policy change away from collapsing, and like they have no control over what the state or federal government really does with them. So I think though it was challenging to see things changing that often, and then also, just the vulnerability of people right now in terms of like, because things are changing so fast. And I've seen this in a lot of my other work as well. Like, it's just hard to give people the assurances I think we usually do of like, I don't know, like 3 years ago, it was like, you can talk about your abortion, all good, no worries. And now, things have just changed a lot. That's, it's like, yeah, so things are changing really fast, which makes it a challenge.
I just wanted to throw out there too, something about what you were saying, Eleanor, like about that urgency that I feel like the current situation creates. So it makes the reporting process feel even more kind of frenetic. And I just want to say to reporters out there, don't let yourself be dissuaded by that. It can create a lot of feelings of, I have to get everything right. I have to, even more than normally, encompass every single fact, every single piece of data. But this is work that's worth doing, regardless of how crazy making it might feel at times. Yeah, I just wanted to add that.
Yeah, and I think Eleanor really raised a good point about the assurances side of things. I think that was something that we, in our case, had to be very blunt about with the people that talked to us, was just, you are taking this risk. And we went over photos, for example, with them to make sure that they were comfortable with how we photographed them, and a lot of other details. But at the end of the day, we could never make an assurance that putting their name out there and putting their photo out there and where they live and what area they're near in this environment where the AP has also reported that they're combing through Medicaid data to to look up home addresses and names of people to identify them. We could never, ever assure them that there wouldn't be a major risk in that. And I think that was something that was really important to, again, my co-reporter, Jacqueline, and I was just being very blunt and direct about the possible consequences that someone might face for putting this story out there, which is obviously hard to do. You know, of course, you know, as a reporter, you don't want to lose that source, but you have to like just be honest with people about the risks they're taking. That's the only fair way to them as well, to be that upfront that this could change your life being in this story. And I think that's something that's really changed over the last couple of years, just in general, for reporters as well, that you can't really make assurances to them.
Well, throughout the year, we've met, part of the cohort, just for those watching, is to meet monthly with experts from the Common Health Coalition and from other healthcare reporters, to learn more about how healthcare delivery and public health systems do or sometimes don't work collaboratively together. So I just would love to know from our fellows your perspective. How did learning more about how the delivery and systems intersect affect how you delivered questions, who you decided to speak with? How did you approach your story differently, kind of having a broader base of knowledge there?
I think, sorry, I'm just trying to formulate exactly how to answer that. I think that asking a lot of questions of sources, especially when you're talking about sources who have personal experience with the topic that you're covering, is really important, because you may end up finding things out about medical delivery that you didn't know to ask. So like going, you know, when you're in an interview and you're trying to go at something from a bunch of different angles, I feel like that's especially important here because, you know, some of us, I think, had health reporting experience. Some of us maybe didn't. I'm not 100% sure on the latter, but, you know, unless you're a health reporter day in and day out for decades, like there's just going to be things that you don't know. And I think being really comfortable with not knowing and asking a lot of questions to try to figure out where the gaps are in your knowledge so that you can really transmit the complexity of the story is really important. Yeah.
I would also say that I think like thinking about not each of these stories as like an individual little thing, but like in the broader context of public health and what's happening right now. And like, I think it's easy to sort of go down your little rabbit hole and say, like, this is just about, you know, can women in rural areas give birth? But like, you know, hearing the like big picture on public health and talking to experts who are not necessarily like the expert on that one little thing, which tends to be like what we track down and find, but like big picture, how does this fit in? I think really helps shape like a stronger story. And like even hearing, you know, like Ted's work about like rural cancer, like it's like, oh right, this is all, and like Amanda about like how do people like, you know, access healthcare when they're facing other vulnerabilities, I think is really helps write a story that feels like you can relate to it sort of no matter what your
Particular interest is.
That's a good point. Jamal, you're tackling the issue of loneliness, which is a universal you know, thing that I think we all think about from time to time. Wondering how has it been for you framing that in the public health, through a public health lens?
I hearing everyone else's stories, I feel very privileged in that, you know, I have been approaching this story differently than I do other things, as is like I want to surface stories that inspire kind of like happiness or less sense of dread amongst readers. And so I think that a lot of people in the public health space has been like very happy to speak about something other than how terrible everything else is in the world. And so whenever I've like a lot of the experts that I have had to track down and speak to have been really happy to just kind of have a reprieve from saying, oh, everything is terrible. But like does it be I've been asking a lot of people to challenge. I've been challenging people to kind of like answer the question of like whether there is any kind of hope or hope for the future that I can have to share with readers, and like that's been really refreshing to see. Yeah.
Thank you.
Yeah.
One question that I think is important for us to look at both as a fellowship cohort, but also you as individual journalists, we'd like to know maybe what you didn't have access to that may have been helpful or may be helpful to future cohorts of the fellowship or others doing this work. When you, for example, maybe went to find a particular data set or source material, what didn't exist that should exist to help you do this important work? We can think on that. We can come back to that.
I'll answer that.
Sure. Thanks, Leja.
Until Trump's inauguration, the second go round, so until late January, there had been many reports in 2024 and a few in early 2025 of human cases of H5N1. Since February, there have been none. So that's a case where it's it makes me wonder where the data is on that, because there was such a boom, like these waves of cases, and it just makes you wonder what is happening with data beyond data that already existed that was disappeared. It makes me wonder what data is actually being captured now, and whether data is being captured that should be made public that isn't.
Beth, can I also answer that question in the context of like looking forward as we, Ted mentioned like the Medicaid cuts. I think that one thing, obviously, as I alluded to, there's a lot of risk in talking with us, but one thing that I would appreciate more of is if hospital systems, if clinicians, if the people practicing in this field, if they did open their doors more. And I think that's really going to be important to tell the story of how public health is changing, how changes to Medicaid are working or not working for hospital systems, for example. So that is just one thing that I always like to stress, that, it's really important that we get access into these places to see firsthand what's going on as journalists and to share that with the public, because otherwise they won't know. And they might not trust what's going on behind those closed doors.
Thank you for raising. Oh, I'm sorry.
Well, and I'll just say at the same time, there's so many interests, financial interests, in healthcare. And I think people are they have long memories and they know the future is long, and they're engaged in what is kind of a repeated game or a repeated negotiation with really powerful entities in their states and federally and other businesses parallel to them. And I found that it's hard to know what the totality of an entity's interests are. And so certainly I would say hospitals are interested in protecting the people who are coming into their emergency rooms and are going to be impacted by Medicaid cuts that will potentially affect their reimbursement rates and the number of patients that they're serving just as a business, even a nonprofit business. But I think because the politics are tricky, I found that, their interests are bigger than that too. It involves like preserving relationships. And so I just think, I guess I'm really reaffirming what you're saying, which is that it would be very helpful if people were very open, but also like the picture is so complicated. And so I mean, I felt like I wasn't entirely getting the most candid or straightforward information in the end, even from people who are going to be directly impacted by what I think is an expert say is going to be huge for their area because they're expecting to renegotiate things later, or they're expecting the policy to change, and sometimes that is where the smart money is. So maybe I don't know everything and just have to take what they're saying with a grain of salt and see.
Which is like, I think a huge problem is that journalists are not typically like MBAs. And I think a lot of stuff gets like really sort of, I think all sorts of interests take advantage of the fact that journalists tend to be word people more than number people. And I think that is a huge gap, is like getting, more in the weeds on like finances and, it helps us like hold people accountable, but also just like write knowledgeably about things we're writing about. And I think that's a huge gap in myself, but also I think generally like journalists coverage of like these complicated financial entities like hospitals.
And it's becoming even more challenging as we see staff size shrink and journalists have to be generalists, and they don't really have the opportunity to develop those specific skill sets. I'm so glad that you raised this in this conversation. Actually, I've been taking notes. And one thing I wish the National Press Club Journalism Institute is in a great position because we can create some of these resources along with our colleagues with Common Health Coalition. But one of the things I hear loud and clear throughout this conversation is the fear factor with sources right now, and just how you have talked about your approach, each of you, your approach with assurances and, explaining the difference between on background, things like that. I feel like something that we could commit to as the Institute is to create some public resources that help better explain some of the confidentiality and some of those assurances. So you've inspired just in this last hour, inspired some new resources that we can create for the public to help journalists get some access in a different way. I'm so grateful to each of you. I'm looking at the clock and I know I want to invite one of our colleagues on from the Common Health Coalition to close us out. But before I do, round robin, what have we missed? What's a takeaway from this fellowship experience that you would like to share with the audience? We can just quickly go around the room. If there's a bit of advice you'd like to share or anything else, just want to hear from you one more time.
I'll just say like these stories are really important, and like just because they're hard to tell right now is probably all the more reason to tell them. And it's hard to get the time and resources to do that. And it's easy. I think editors often are quick to say like, if this is going to be hard or complicated, like let's pass and do something easy. And I think finding resources to fund or even just like force the time to do complicated stories, like the only way these stories get done. So keep pushing.
My advice, I guess, is for freelancers. It's hard. It's really hard. Eleanor's talking about from a staffer's point of view, and then from a freelance point of view, it's even harder because you have to put in the time to find the story, to know that you're going to be able to secure the story. We should all do what we can, even if as freelancers can't, donate money to organizations like the National Press Club Journalism Institute. Do all we can to support like IRE, all of these places that do offer funding for us to report these important stories, because as much as I value staff reporters, I also think that freelancers, we have, and this is a huge part of why I've always been a freelancer, is that we have the ability to sometimes look at stories in a different way, because we're not beholden to any one media outlet. So freelancers, don't give up.
I think when you're reporting on public health, it is things are really difficult, and a lot of people are going through a lot of terrible things. And but not everyone and not everything is terrible. And I think I've learned a lot from the way that readers respond to stories is that we're really desperate to be reminded of the things that we should also aspire to societally, personally, in the like larger spirit of health. And I want to remind people to like look for those stories as well.
That's good advice, Jamal. I would just say, just always be thinking about, you know, who's going to be impacted by all of these changes that we're seeing, and make, you know, just always think about those actual people, and less about, you know, who's making the changes sometimes, I think.
And I'll just make one plug for also trusting your instincts and persisting. And I'll just say, you know, sometimes get a good idea, people say no to you. My point of view is always just take it to other people, and eventually you'll find someone that will let you write it. So, and that was my experience here.
Thanks, Ted. And thank you all. I hate that we're almost out of time. Ted, Amanda, Jamal, Eleanor, and Leisha, I just want to say how much I appreciate, and our team appreciates your commitment to your projects and to this work that you're doing and continue to do. I know we have a few projects that are going to publish a little later this summer. So we'll look forward to sharing those out, and hope that you'll share your colleagues' work as well. And we know for everybody on this call, especially the journalists on screen, that there's much more work ahead to do. And hopefully we can do that with a careful eye and also a little joy, as Jamal has pointed out. I also would like to repeat how grateful we are to the Common Health Coalition for investing in public health journalism at a time when access to care and to information is growing more scarce. Without your support, the fellowship program would not be available or possible. So I want to invite the managing director of the Common Health Coalition, Chelsea Cipriano, to join us on screen to send us off as we close out our time together. Chelsea?
Thank you so much, Beth. Thank you, everyone. This was wonderful. I really, I could say so much, but I won't. There's no time. I think I won't quote her, but as Eleanor said, you took the words right out of my mouth. These stories are so important, even if they're hard to tell. So thank you for telling them. Thank you for sharing your work and also your learnings. To Beth's point, the lessons learned outside of just the content, you've given us so much to digest about how we can help the health sector feel like they can and should open their doors and open their work, even when there is fear or uncertainty, really by acknowledging the benefit of doing so, and not just the risk of opening that door, but really the benefit and that a spotlight provides, because we can't make progress for the people we're ultimately serving, patients, our families, communities, without lending that spotlight to things that drive progress. So thank you. Thank you. Thank you. We have some resources that we want to make sure that folks are aware of, and some new products that have launched through partners like PopHive from the Yale School of Public Health for those who are navigating this uncertain data landscape. That is a new platform that they just launched that really shows data across multiple topics, that it incorporates healthcare data, public health data, and they're building that out and they want feedback. So if you're using that tool, please use the form on the page to give feedback. On our website, we have case studies. We're really trying to put the spotlight on organizations doing work on the ground that may otherwise not get it. But we want to hear from you about what else would help in terms of getting access to the health sector for that ultimate goal of driving better health. So thank you so much. Thank you all again. This is a great success, and we can't wait to dig even further into your work and help amplify it. And so thanks again.
Thanks, Chelsea. And thank you to our fellows and to our audience. I guess last words, please stay well. We know that this is a very difficult time for us professionally and also challenging personally. So just please stay well and take care of yourselves and each other. Have a great rest of the day.
Bye, guys.